The FDA is expected to approve Pfizer's coronavirus vaccine for emergency use after an advisory panel voted to endorse the drug. White House Chief of Staff Mark Meadows has pressed the FDA to grant an emergency use authorization for the vaccine by the end of today or face possible dismissal. The vaccine won an endorsement Thursday from an FDA panel of outside advisors, and agency sign-off is the next step needed to get the shots to the public.
This jumpstarts the plans for shipping vaccines across the country, but it doesn't mean vaccinations can start just yet.
News 3 Now's Amanda Quintana has details on those next steps.
This is a big first step, but it's still just a first step. The Advisory Committee on Immunization Practices, ACIP, still has to give their authorization, and here in Wisconsin, DHS does too. But a victory is closer.
Don't lose that aggressiveness. Don't take that eye off the ball.
Dr. Matt Anderson feels a bit like a coach. He says the FDA vaccine authorization puts us in the fourth quarter, but the game is not over yet.
We can't get into a prevent defense at the end of the game because that prevents you from winning. We know that people are still vulnerable in the current state, and we're going to have a lot of that risk still for coming months.
He's hopeful vaccine shipments could start arriving at UW Hospital next week. Approval from DHS maybe later in the week. Then finally, the vaccines can give frontline workers, those with the highest exposure risk, some relief.
Not that they would stop wearing their PPE, not that they're going to stop physical distancing or doing those other things, but it does give them a little bit better sense of comfort and well-being, we hope, as well, to know that there is this added layer of protection.
Anderson admits even once all healthcare workers are immunized, which will take months and multiple rounds of deliveries, that won't be enough to stop the spread, but it will reduce it and to keep hospital staff healthy enough to keep taking care of those who do get sick. But he says they can't be the only ones fighting. The rest of the team needs to continue too.
The victory over the pandemic is in sight, but we need to be careful that we're not playing not to lose and we just say, oh, we can go do what we want.
UW Health will be getting about 4,000 doses of Pfizer's vaccine, but without a finalized plan from DHS yet, they're unsure how many of those are for their employees and how many are just being stored there for employees at surrounding hospitals. In Madison, Amanda Quintana, News 3 Now.
Well, the FDA plans to review Moderna's vaccine in the next week or so, but right now the Pfizer vaccine, that's the only one being sent to our area.